From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle To Crayon Show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you. From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle To Crayon Show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice. We say thank you to our sponsors, Back Specialist Hospital and Fertility Center, and also to Rohi Children's Clinic. In the course of the show, as we do every time, we open our phone lines. Now, has there ever been a time where your child will suddenly stop what he or she is doing and begins to shake uncontrollably, and you just don't know why this is happening? For some families, this is their reality. This morning, I've been joined by a pediatrician from College. We want to discuss epilepsy in children. We want to talk about what this actually is and how it's affecting the many children who are living with it and their families, and what parents, caregivers, and even teachers in school can do in emergency situations. But before then, we'll take a break. Message from our sponsor, Rohi Children's Clinic, as they talk about allergies. We'll be back.
This guy in our class who was always sneezing or blowing his nose, and nobody wanted to sit with him in class because we're all afraid we'll catch a cold. Now I know better. Kids who do that may have allergies, Sadly, such kids suffer quietly because no one pays any attention. Some people even label them as annoying. Most allergies are mild, but any kid with allergies can have a severe life-threatening reaction if the circumstances are right for that. But help is available. So talk to your child's doctor and let's make life easier for our kids with allergies.
Rohi Children's Clinic, children receive more than treatment. They receive full attention in a caring atmosphere. Their services include specialized care for diseases of babies, children and adolescents. There's well child clinics, laboratory service, health screening, and school health service for new entrants and continuing students. They are ready to serve you from Monday to Friday from 8 a.m. to 7 p.m. On Saturdays, they are open till 2 p.m. Locate Rohi Children's Clinic at Rees Junction at Denta, or call them on 0200 342 960 or 0592 053 235. Website is www.rohicc.com. Rohi Children's Clinic. Experience total care. Now visit Back Specialist Hospital for all your fertility, maternal and general health concerns. Their services include IVF, IU and other fertility service. It's women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care, surgical services, theater services, laboratory and ultrasound scan services, amongst others. Locate them right here in Accra, they are in Taifa, or call them on 0558 862 292 or 0592 196003. Pastor Charlie's Hospital and Fertility Center, integrity and excellence in health care. Our WhatsApp line is 0540 130 684. We are live on Facebook. Check out Sunny 88.7 FM Facebook page, Cradle To Crayon Facebook. Join us on Sunny TV. Join the discussion. You can also join us on our Sunny FM app, Sunny TV app, and then join in the discussion. My guest this morning is Dr. Hannah Sharon Mills, pediatrician from Kolebu. Dr. Mills, good morning.
Good morning, Abby.
It's good to have you here.
It's good to be here.
How many years has it been?
Maybe about 2.
It's good to be back here. Yeah.
Yeah.
So, epilepsy in children. What are we talking about?
All right. So let's start with the basics.
Okay.
Okay. Everyone has a brain.
Yeah.
And the brain is made up of two main halves. Now, in your brain, you have millions of brain cells or neurons, and these cells communicate with electrical activity or electrical signals. So there's normal brain activity where these electrical signals are being conducted. But sometimes, for some reason, in some individuals, you have a sudden, unexpected surge in the brain activity, the electrical activity, and then this may be seen as a seizure. And we know that children have seizures, adults have seizures as well. But when we say someone has epilepsy, it means that they have a predisposition to have repeated or recurrent seizures. And these seizures that happen are not due to certain things like an acute infection that's going on, like malaria. It's not due to meningitis. It's not because they have low blood sugars because they are sick, they are not eating. It's not because their sodium or potassium levels in the blood are low. Because we know that these are generally common things that can cause seizures. But with epilepsy, it's an unprovoked seizure, or they have repeated unprovoked seizures. So that's what epilepsy is.
Okay. Is it common?
It's very common, yes. Globally, more than 50 million people worldwide have epilepsy.
Okay.
And most of these individuals have epilepsy beginning in childhood.
In childhood.
Yes, so that's why it's
How
important.
early? What age are we looking at?
As early as the first day of life. You can have newborns.
As a baby.
Yes, newborns who
Okay.
have seizures and develop epilepsy later on in life, yes.
Okay. Okay. Let's look at common signs to watch out for.
Okay.
For parents who've not actually they know seizures, but
Mm-hmm.
what common signs are there for them to watch out for?
Most commonly, when we think about seizures, what we all think about is the shaking movements, the stiffness. And that's one of the more common signs of a seizure. So you may notice that a child is stiff. There may be shaking of all four limbs. Sometimes these children have what we call an aura. So they may know that they're about to have a seizure because they have certain changes. Some children may smell something in peculiar. Some might have a headache. Some might have pain in their stomach. And some just have a funny feeling like something is going to happen. So it's important to find out if they have these aura so that we know that if it's happening, a seizure might follow soon. And apart from the shaking movements, some children may also have what we call absence seizures. They are doing something, they are in class, they are writing, they are playing, and suddenly they just stop. They stop what they are doing. They may be staring. You may notice some subtle movement of their lips, or they may be doing something subtle with their hands, and that could be a seizure as well.
For them, that's actually the first time it's happening.
Yes, that could be the first time
First
it's
time,
happening, and for
okay.
them that could be the only manifestation of the seizure that they have.
Okay.
So these children may not have the typical shaking movements and the stiffness, but they have this blank staring.
Okay.
And with other children, it may not involve their whole bodies. They may have unusual behavior. They may have just one side of their body twitching or shaking. And those are all seizures, things
Okay.
that we need to look out for.
Okay.
Okay.
Okay. So the seizures, is it the same for all the children, or are different types of it?
There are different types
Different
of seizures.
types.
Yes. There are
Okay.
two main types of seizures that we know about. So we can say a seizure is either generalized or it's focal. Remember, we said there are two halves of the brain.
Yeah.
So
Yeah.
if a seizure is generalized, it means that the abnormal electrical activity that's going on, it's likely happening in both sides of the brain at the same time. Sometimes you can have a seizure or the abnormal electrical activity in the brain starting off at one side, and then it quickly moves to another side of the body. If it starts in just one side of the brain and it stays there, that's when you may notice that the child has movements of just one arm or one leg or one side of their face. But some move to the other side. So it starts at one arm and then quickly you see that the whole body is shaking.
Okay. Okay. When it comes to treatment, so for a parent who's experienced this, the child has had maybe the first episode and then you've been informed. When they come in, how is it? Do you run tests? How's the treatment a whole? How's it all like?
Okay. It depends on what the cause is
What the cause is.
and what how the
Can
child
we go back
presents.
to the cause? I remember you had said there are two sides of the brain.
Yes.
So there could be different causes.
There could be different causes.
Okay.
Sometimes a child has meningitis,
Okay.
let's say in the first year of life.
Mm.
If it's not treated properly, later on there could be complications from that. So a child would develop seizures later on.
Oh, that's automatically, I mean, epilepsy.
Yes,
Or
and
not
that is
necessarily?
epilepsy. In the acute period, when they have meningitis, we are treating for meningitis. They may have seizures.
Okay.
But once
okay.
we treat for meningitis, those seizures should stop.
It should stop.
However, if later on in life the child continues to have seizures, they have repeated seizures despite not having an acute infection,
Okay.
then they have epilepsy.
Epilepsy. Okay.
At other times, when a child is born, they don't cry. And if you don't cry at birth, it means that the
Asphyxia.
oxygen... Exactly. If they have birth asphyxia, it means that the oxygen that's supposed to go to the brain isn't going there. It could lead to certain changes in the brain, abnormal connections in the brain, and that could result in epilepsy later on in life.
Okay.
You could also have certain structural changes in the brain which may be present right from the period when the baby is developing in the mother's womb. And so that could lead to epilepsy later on in life. Sometimes even being involved in a road traffic accident, having head trauma,
Okay.
it could
Okay.
lead to epilepsy later on.
Okay.
Sometimes as well, we know a child has epilepsy. We are not able to say exactly what is causing the epilepsy, but they have epilepsy. In those cases, we say it's idiopathic or the cause is unknown.
Okay.
And then we also have instances where there are changes in your DNA or genetic changes which could increase your risk of developing epilepsy.
Okay. 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 So it takes us back to the question. Once a child is brought after the first episode,
Okay.
what tests do you want to confirm before we come to treatment?
All right. Epilepsy is a clinical diagnosis. So having the history that a child is shaking or they have these blank spells helps us to make a diagnosis of epilepsy, especially if we have any of the risk factors that we've spoken about. And so
Talking about risk factors, is it hereditary?
in some instances,
In some instances,
it could be hereditary because if
Okay.
there are changes in your DNA, you could pass it on to your children.
Okay. Okay.
But this isn't as common, especially in our setting.
Okay.
Okay.
Okay. So back to our tests.
So with the test, a doctor who sees a child who has epilepsy might want to do a test called an electroencephalogram.
Okay.
A big word. So you shorten it to an EEG. You know how you have an ECG for the heart? You look at the heart's electrical activity. Remember, the brain also has electrical activity. So an EEG looks at the electrical activity of the brain. And normally, when we look at this, it's amplified. So you see it on a graph as spikes or
Goes up, down,
yes,
up,
goes
down.
up
Yeah.
and down, just like you see on an
Yeah.
ECG.
Yeah.
But if someone has epilepsy and an EEG is done shortly after they've had a seizure, you may see some abnormal changes on that EEG. So that's an indication that the child could have epilepsy. And it also helps because it tells us which side of the brain is
Okay.
likely involved
Okay.
in the child's seizures.
Okay.
And that's important because depending on whether it's a generalized or a focal epilepsy, there are certain medication which we may decide to use to treat. Okay. Another test which we might do is a brain MRI. A brain MRI looks at the structure of the brain. We said that sometimes there could be changes in the structure of the brain which could predispose an
Yeah.
individual to
Yeah.
having epilepsy. So
Yeah.
a brain MRI can help pick that up. And would also do basic tests like a full blood count, looking at the white blood cells, the red blood cells, the platelet levels, and then also electrolytes. When we talk about electrolytes, we are looking at the metabolites in the blood. So things like sodium, potassium, calcium,
Okay.
because sometimes when these are high or low, it could result in seizures. And that does not necessarily mean that someone has epilepsy, but it helps us to rule out other common things which could result in seizures. In children, we could have some of them who come, they have seizures and they have a fever as well. And these are known as febrile seizures. febrile seizures are not epilepsy. If a child has a febrile seizure, we usually try and find out what is causing the fever and what is causing the infection, because we know that when a child has a fever, their seizure threshold goes down. So there's a lower risk that they'll have a seizure during the period when they have a fever. So we'll do things like a malaria test, we'll do things like a blood culture to make sure there's no bacteria that we need to treat. And usually after that period, they are fine.
They're fine.
Yes. And these febrile seizures usually occur in children between the ages of 6 months to 6 years of life. And after that, they don't usually have seizures that occur with their fever.
Okay. Well, it's just 12 minutes to top of that. I have here Dr. Hannah Sharon Mills. We are discussing epilepsy in children. We say thank you to our sponsors, Rohi Children's Clinic, and also to Back Specialist Hospital and Fertility Center. Our phone lines have been opened. Number to call is 0540 130 684. 0540 130 684. It's the same WhatsApp line. Send us a WhatsApp message. Can also call in. Also drop a message on our Facebook page. My doctor here will answer you. Dr. Sharon, I mean, I've not personally witnessed a child who's having a seizure, but I've seen in movies where, and when it happens, people are like, yeah, Kolani say, you say there are all sort of teachers around who are giving instructions as to what to do. I want to find out, what are the do's? What shouldn't we do in the cases where the emergency happens? And then what should actually be done, the right way to do it to save the child?
All right, so that's very important. Seizure first aid is key.
Yeah.
When a child has a seizure, the first thing you should do is try and make sure that they are in a safe environment, especially if they are having a tonic-clonic seizure where they are shaking and they are stiff, because if that happens, they may injure themselves. So try and make sure that the environment is safe. There's nothing that
Clear
can...
the area.
You clear the area, exactly. There's nothing that can hurt them. And you should try and make sure that their heads are not going to be hitting the ground. So if you could put a soft cloth or pillow underneath, or even put their head on your lap so that you can cushion their heads, that's fine. You shouldn't try and restrain a child who is having a seizure. Do not try and put...
Restrain us in tie
hold
the hand.
them.
Okay.
Yes. Let the seizure continue. It will usually abort on its own.
Okay.
If they are wearing any tight clothing, like they have a tie on, try and loosen it. If they are wearing shirts that have buttons,
Button
try
up to
and-
the neck.
you can try and unbutton it. And then do not put anything in their mouth.
Hey, we've heard the contrary. That
No,
put spoon in
please.
their, they're not
Don't
supposed
put
to
a
close their
spoon in
teeth.
their mouth.
Hey.
Don't put your finger in their
Information
mouth.
is key.
Because that can actually make them hurt themselves. You can get your finger
Yeah,
bitten
they can
off.
bite you.
Yes. So don't put anything in their mouth.
Okay.
Do not try and give them anything to drink. So no water poured on them, no medication given at that time.
No medication.
Yes, because if they are having a seizure and you try and put anything in their mouth, give them something to drink, there's a possibility that it will go down the wrong way. Instead of going into the stomach, it's going to go into the lungs, and they can choke on it or aspirate, and that can lead to more problems.
Okay.
So what you need to do is to stay calm, keep the child safe in an environment
You just
that
don't
is
do
safe.
anything. Clear the area. Let
Clear the
child-
area. Watch your clock.
Okay. How long does it last?
Most seizures usually abort within 2, 3, 4 minutes.
Okay.
If a seizure is going on for more than 5 minutes, it's a prolonged seizure. So that's
you
why
need to
it's
be timing
important,
it.
yes, to time the seizure and note how long it's going on for. If it's going on for 5 minutes or longer, you need to start taking the child to a hospital. If a child has epilepsy and they usually have prolonged seizures, we'd give them what we call rescue medication.
When you say prolong, as in the episode
More
time
than-
or more, it happens often.
If it happens and it goes on for longer than 5 minutes,
More longer than
that's
5
a
minutes.
prolonged seizure.
Okay.
So for these children with epilepsy, we'd usually give what we call rescue medication. So
Okay.
there's medication that we can prescribe for the parents to take home with them.
Okay.
And if they notice that the seizure is going on for longer than 5 minutes, then they can give this medication to try and stop the seizure while taking the child to the hospital.
Okay. Doesn't it stop entirely? The seizures doesn't go.
A lot of them, thankfully, stop on their own.
Okay, as they are going.
Oh, you
As a
mean for
children?
children with epilepsy?
Yeah.
It depends on the type of epilepsy they have. Some children outgrow their seizures, and with the
Okay.
right medication, some children can stop taking the anti-seizure medication
Okay.
and they are fine.
Okay.
Okay.
Okay. I've heard lots of stories, beliefs, myths about epilepsy. Some people say it's contagious. once you have it and then somebody has it, you touch the child. I mean, so many. Once you are here, please correct them for us.
A lot of the time when we are at the emergency room and a child has a seizure, you notice that it's the men who
They run away.
No, the men,
The men bring them.
carry the child
Okay,
with the
because they are
seizure.
stronger.
So they say that if a child is having a seizure and the mother or a woman carries the child, then the epilepsy is likely to be transmitted
to the woman,
and whatever children that
this
she
is news
has.
to me.
Usually when someone has a seizure, that's what, man, bro.
I was thinking because the child, you need a stronger person, not to, because a woman might drop the child, and you there's fear that what's happening to my child. So the men who are stronger will carry the children.
So that is the myth behind it.
Okay.
Epilepsy is not contagious.
It's not.
Seizures are not contagious. And it doesn't matter whether you share cups, you share spoons, you live in the same house with a child. Epilepsy is not contagious. We've spoken about the causes of epilepsy, so we know that it can't be transmitted from one person to another. Epilepsy is not contagious. It's usually the stigma that is the stigma.
Yeah.
Unfortunately, in our society, is still a big issue. Sociocultural issues, the idea that epilepsy is due to someone being cursed or witchcraft. That's not the case at all. And we need to do away with those myths and misconceptions.
How are you helping mothers with that? Because I am sure some mothers, their children going to school, telling the community, and this is what my child has. It'll be tough for them.
It is.
Yeah.
At Kolebu, we run the neurodevelopmental clinic every Monday, and we see a lot of these children with epilepsy. I remember we've had some mothers who come in practically in tears because their children they are sort of isolated. Other children don't want to play with them.
Are the schools aware?
I am not sure. I should think
I think
so.
this education should be done in the schools as well.
We need to do
so
that.
they know,
We need
like
to
this
talk
time when
more.
you're telling me, don't put spoon in their mouths. I mean, I know, I've heard and I thought, okay, this is right. Now you're saying this is not. So imagine a school where the teacher doesn't know. Say, move attention in when this happens.
We need to do more education. We need to talk about epilepsy and create more awareness.
I have this question. It's saying, good morning, doc. Please, my son is 1 year and 3 days, but he's not walking. Meanwhile, he started holding on to sofa and walk at 7 months. What could be the issue?
Okay, this one we need to take a full history.
Okay.
But the fact that he is holding on to things and moving around is a good sign. I'd ask questions like, was this a child who was born at term or were they preterm?
Preterm, okay.
Because preterm babies may be a little more delayed with their development compared to other children. And then it's important to know when to expect the developmental milestones to be achieved. Usually we say that up to 18 months or a year and 6 months, a child would have started walking. And I think it's a good sign that he's holding on to things and moving around. If she's concerned, she can bring the child to the hospital. So we do a full history examination and take a full assessment of the child.
How's the support group for the women like? The women and the children?
With epilepsy?
Yeah.
We have some support groups, so they are able to talk to each other, talk to us if there are any issues. But as part of management of children with epilepsy, we know that they could have a poor quality of life compared to their friends and
who don't have it.
Yes, who don't have it.
Why is that?
For various reasons, stigma at the top of it. But then also the fact that they have seizures, they are missing school, they have to take medication every day. And with epilepsy and seizures, you may not always know when you're about to have an episode.
Predict it.
So that is also one of the reasons. So support is important from family, from the society, from us as healthcare workers as well. And we usually involve the clinical psychologist as well, because children can get depressed. They can be anxious because of the underlying condition. So all of that is important in care.
Okay. Does this condition affect their day-to-day life? So maybe living your active life, your normal life, you can be involved in sports, or they are refrained from doing all that?
A child with epilepsy, should be treated just like any other child. If you were going swimming with your 11-year-old, you would watch him in the pool, isn't it? In the same way, if you have a child with epilepsy who is going swimming, you would watch them. So they shouldn't be restricted, but you need close supervision, just like you would with any other child. So they can engage in sporting activities, they can go to school. Children with epilepsy are just as smart as other children, unless they have a cognitive issue associated with the epilepsy. So they shouldn't be restricted in any way, because restricting them also isolates them and worsens the stigma that's associated with the condition.
Okay. For parents listening who has just received a diagnosis or know someone who has it, what would you tell the person? What advice, what can you tell the person? Even the community, people who still think this is contagious for a child who has it, I don't want my children to play with them. How do we make the noise and let them understand this is not as they think?
Okay. Epilepsy is just like any other medical condition, like sickle cell, like asthma, whatever it is. We can give treatment for it. Some children take daily anti-seizure medication. After they've taken it for a few years, they no longer have seizures. And then we can think about tapering down or stopping the anti-seizure medication. Children with epilepsy should be included in everything, in school, in the community, in church. They should be treated just like any other child. It's a diagnosis, but it shouldn't define your child. Your child can still achieve their full potential.
Okay. It's a month-long campaign you're doing.
February.
So how's the plan like? What are you doing?
Okay, we've been doing media engagements. We have been educating patients and caregivers at our OPDs. On Monday, we have a talk for healthcare workers as well, to increase awareness about management and treatment of children with epilepsy. And then we're also trying to organize an epilepsy awareness walk. So those are all things.
You're involving the children and the parents.
Yes, children and parents.
Okay. Thank you so much. Our time is up already.
No, that's fast.
It's been fun having you here. Thank you.
Thank you, Abby.
Thank you to all those who listen to our sponsors with it. Thank you so much. Don't forget, tomorrow morning, 9:30, there'll be a repeat broadcast on Sunny TV. Have a good working day and stay blessed. Bye. From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle To Crayon Show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children